Good morning. Today we are going to learn about the posterior compartment of leg. So the posterior compartment of leg is also called the flexor compartment, and the leg is entirely enclosed by the deep fascia that is called the fascia cruris. The fascia cruris in the lower aspect, in the medial aspect, it is modified to form a retinaculum so that it can hold the tendons of the muscles of posterior compartment in place. So this retinaculum is called flexor retinaculum. It has been cut here to show you the tendons. So here we have the flexor retinaculum, which is a modification of the fascia cruris in the lower aspect. And the flexor retinaculum is attached from the medial malleolus. So this is the medial malleolus to the calcaneum. Coming to the muscles in the posterior compartment, the muscles can be divided into a superficial group and a deep group by a fascia that is called the deep transverse fascia. The muscles in the superficial group are these two muscles. This is the gastrocnemius. This is the lateral head of gastrocnemius, and this is the medial head of gastrocnemius. So you have the two heads of gastrocnemius. Already you have learned about the gastrocnemius forming the infrolateral and inframedial boundary for the popliteal fossa. So these are the two heads of gastrocnemius. Then you have another slender muscle that is called plantaris. So this muscle is plantaris. It is having a very small muscle belly and a very long tendon. So this is the plantaris muscle. It is an occasional muscle. It need not be present in all humans, and it can be easily confused as a nerve because of the long slender tendon. Then another muscle that is present in the superficial compartment is the soleus muscle. So deep to the two heads of gastrocnemius, this bulky muscle is called the soleus muscle. It is having the shape of sole. So that is why it is called soleus muscle, and it is taking origin from both the bones, that is from both the posterior aspect of fibula and from the tibia. From the tibia, it is taking origin from the soleal line and from the medial border of tibia. So this is the large muscle that is called the soleus muscle. So the two heads of gastrocnemius and the soleus together, they are forming the triceps surae. The conjoined tendon of triceps surae is getting inserted into the posterior aspect of calcaneum, and this conjoined tendon is called the tendoachillis or the tendocalcaneus. And the plantaris tendon is seen between these two muscles, that between the gastrocnemius and soleus muscle, and finally it blends with the tendocalcaneus. That is about the superficial muscles. So superficial muscles include the two heads of gastrocnemius, the soleus muscle and the plantaris muscle. Then we have the fascia that is called the deep transverse fascia. And deep to the deep transverse fascia, we have the deep muscles. So when we cut through the soleus, we can expose the deep muscles. So this is the lateral aspect. So this is the lateral aspect. So this muscle that is taking origin from the fibula, this is the fibula, taking origin from the fibula is called the flexor hallucis longus. It is called the flexor hallucis longus. Then from the medial aspect, that is underneath the soleus, the medial aspect over here, that is taking origin from the tibia, this muscle is called flexor digitorum longus. So from the fibula we have flexor hallucis longus, and from the tibia we have flexor digitorum longus. Then deep to these two muscles at a very deep plane, this muscle, can you make out? This muscle is the tibialis posterior. So there are three muscles below the soleal line. So you know where the soleal line is. You have the soleal line. Below the soleal line, deep to soleus, you have three muscles. Flexor hallucis longus taking origin from fibula, flexor digitorum longus taking origin from tibia, and at a deeper plane you have the tibialis posterior, that is taking origin from the interosseous membrane and also from the adjacent parts of tibia and fibula, tibialis posterior. These are the deep muscles below the soleal line. Above the soleal line, there is another important muscle, this fleshy fibers, that is the popliteus muscle. Popliteus muscle we have already studied. It is forming the floor for the popliteal fossa. So this is the popliteus muscle. It is having an intracapsular origin from inside the capsule of the knee joint from the femoral condyle, and it will pierce the fibrous capsule in the posterior aspect. You will be learning this in knee joint, and it will come and get inserted into the tibia above the soleal line as fleshy fibers. So this is the popliteus muscle. So the deep muscles include four muscles: flexor digitorum longus, flexor hallucis longus, deeper plane. At the skeletal plane you have the tibialis posterior, and above you have the popliteus muscle. These are the four muscles of the deep compartment. So coming to the nerve of this region. In the back of thigh we have learned the thick nerve is called the sciatic nerve, and at the upper angle of popliteal fossa, it is going to divide into tibial nerve and the common peroneal nerve. So the tibial nerve is going to come down from the upper angle to the lower angle of the popliteal fossa, and it is coming into the posterior compartment. Below the tendinous arch of origin of the soleus muscle, the tibial nerve is going to pass into the posterior compartment, and the nerve of the posterior compartment is tibial nerve. It is giving branches to the muscles. So what are the muscles that are supplied by the tibial nerve? We have the deep muscles, that is flexor hallucis longus, flexor digitorum longus, and the tibialis posterior, and also the soleus. These are the muscles that are supplied by the tibial nerve at this level. The superficial muscles, the two heads of gastrocnemius, and also the plantaris is supplied by the tibial nerve in the popliteal fossa, whereas in the posterior compartment it is going to supply the soleus muscle, flexor hallucis longus, tibialis posterior, and flexor digitorum longus. So this is the nerve of the posterior compartment. The tibial nerve, when it comes underneath the flexor retinaculum, it is going to divide into medial and lateral plantar nerve. Medial and lateral plantar nerves, which is going to enter into the sole and supply the muscles in the sole. In this specimen, you can see this is the tibial nerve, and it is having a higher division. It is dividing into medial and lateral plantar nerves at a higher level. It is supposed to divide under the flexor retinaculum and then enter into the sole, but here it is dividing at a higher level. So there is a variation. So tibial nerve terminates by dividing into medial and lateral plantar nerves. Now coming to the artery of this compartment. Popliteal fossa, you have learned about the popliteal artery. So this is the popliteal artery. The deepest structure is the popliteal artery. At the lower border of popliteus, this is the popliteus muscle. At the lower border of popliteus, it is going to end by dividing into a posterior tibial artery and an anterior tibial artery. The anterior tibial artery will go into the anterior compartment, whereas the posterior tibial artery will come down, and it is the artery of this compartment. So this is the posterior tibial artery. About 2.5 centimeters below its origin, it is going to give another artery, this artery, that is called the peroneal artery. And this peroneal artery will go into the peroneal compartment, the lateral compartment. And posterior tibial artery will continue down. You can see it is accompanied by two bluish structures. This is the venae commitans of the posterior tibial artery. Venae commitans. Up to the knee joint, we have a corresponding vein for each artery. But below that, posterior tibial vein, anterior tibial vein, peroneal veins are not as single veins, but they are seen as venae commitans accompanying the artery. So this is the venae commitans accompanying the posterior tibial artery. And posterior tibial artery is going to give muscular branches to all these muscles, and when it reaches here, beneath the flexor retinaculum, it is going to divide into medial and lateral plantar arteries, and it is going to enter into the sole. So tibial nerve is dividing into medial and lateral plantar nerves, and posterior tibial artery is dividing into medial and lateral plantar arteries. Now posterior tibial artery pulsations can be felt at this point, that is midway between the medial malleolus and between the calcaneum. Midway between these two bony points, you can feel for the posterior tibial artery pulsation, and you will have to check for the posterior tibial artery pulsations in the lower limb of patients, midway between the medial malleolus and the calcaneum. We were talking about the flexor retinaculum. So flexor retinaculum is the modification of the fascia cruris at the lower aspect from the medial malleolus to the calcaneum, and it keeps the tendons in position. All these muscles are forming tendons by the time they reach here, and these tendons are arranged in a particular order from medial to lateral. From medial to lateral, first tendon is, this is the tendon of tibialis posterior, the deep muscle. This is the tibialis posterior tendon. It is grooving the posterior surface of medial malleolus. Then just lateral to it, this tendon is the flexor digitorum longus. So we have tibialis posterior, then we have flexor digitorum longus. Then it is the artery, that is the posterior tibial artery, and then it is the tibial nerve. But since here tibial nerve is divided earlier, you cannot make out that relation clearly. But after flexor digitorum longus tendon, you have the posterior tibial artery, then you have the tibial nerve. And the last tendon is flexor hallucis longus. You can see when I pull this tendon, look at this tendon. When I pull this tendon, you can see the flexor hallucis longus. It is getting inserted into the distal phalanx of the big toe. So these are the tendons when we move from medial to lateral. So that is tibialis posterior, flexor digitorum longus. This is the posterior tibial artery. Then you have the tibial nerve, and finally you have the flexor hallucis longus. So there is a code to remember this structures in order, that is Tom, Dick and Harry. Tom is, T stands for tibialis posterior. Then D of Dick stands for flexor digitorum longus. Then and, the A stands for the artery, that is posterior tibial artery. N of and stands for tibial nerve, this is the tibial nerve. And Harry, H stands for flexor hallucis longus, Tom, Dick and Harry. So these are the structures in order underneath the flexor retinaculum. Posterior compartment is often asked as a discussion topic for your practical exam, and you have to demonstrate the structures under the flexor retinaculum in order. Thank you.